Hello everyone. We will continue with the iatrogenic lesions. So the effects of ionizing radiation. Radiation in therapeutic doses injures every living tissue to some degree. So the beneficial effect depends on sensitivity and regenerative capacity of normal and malignant cells. Early phase changes of radiation include nuclear and cytoplasmic enlargement, cytoplasmic vacuolization, amphiphilic cytoplasm, nuclear membrane irregularity. There is seen multinucleation, prominent nucleoli, bizarre shapes, pycnosis, and karyophysis. The late phase changes, they are persistent nuclear and cytoplasmic enlargement but without vacuolization. So no vacuolization. There is seen fibrous reaction in the form of deposition of collagen and fibrin in the stroma. Arterial sclerosis is seen. This is the cervicovaginal smear after ionizing radiation. So this microphotograph is showing the effects of radiation. It shows acute cellular changes like nuclear enlargement and cytoplasmic enlargement. Nuclei are showing prominent nucleoli, multiple nuclei, that is multinucleation. The cytoplasm is showing vacuolization. Irregular shapes. So how radiation will affect the neoplasm? So effects on neoplasm. Radiation will induce necrosis along with nuclear and cytoplasmic vacuolization, bizarre cells, and altered differentiation. The differentiation of the tumor is lost or there is seen alteration in the differentiation. In squamous cell carcinomas, post irradiation, there is seen increased keratin. So squamous cell carcinoma has more keratin post irradiation. There is increased pleomorphism and cytomegaly in undifferentiated nasopharyngeal carcinoma and transitional cell carcinomas. Breast carcinoma, endometrial carcinoma and undifferentiated lung carcinoma, they show squamous metaplasia after radiation. The squamous cell carcinomas of head and neck and cervix, they are persistent tumor. They persist after radiation for longer period. So effect of radiations on skin and mucous membranes. The skin and mucous membranes, they will show edema, dilated capillaries, swollen endothelial cells, enlarged or necrotic pilosebaceous apparatus and sweat glands. There may be seen epidermal atrophy or acanthotic epidermis. There is hyperkeratosis, atypical nuclei, swollen and hyalinized collagen, ectatic capillaries and stroma is death. In salivary glands, radiation induces distension of ducts and acini in acute phase. There is loss of acini with presence of chronic inflammation with increased nuclei and increased fibrous tissue along with squamous metaplasia. Radiation in intestine will cause radiation enterocolitis. In this, there is villous atrophy, mucosa is ulcerated, atypical hyperplasia may be seen, edema, inflammation, vascular damage is present. There is destruction and fibrosis of the circular muscle layer. In liver, veins will show intimal thickening. So there is intimal thickening of veins in liver. So radiation will cause presence of atypical cells in breast. There is atrophy and lobular fibrosis. In thyroid, post-radiation, colloid nodules may be noted. There may be seen foci of hyperplasia, frequent oxyphilic cell and lymphocytic infiltration. In kidney, radiation will cause radiation nephropathy. In this, there is seen sclerosing nephrosis, nephroglomerulosis, and hypertensive necrotizing vasculitis. In urinary bladder, the radiation will induce transitional epithelium damage, exfoliation of atypical cells. The chronic damage will cause deep ulceration, fibrotic contraction, and fistula formation. Post-irradiation prostate will show squamous metaplasia, cytologic atypia, giant cell reaction due to necrosis, atrophic and fibrotic seminal vesicle. In uterus, stratified endometrium with pleomorphic vacuolated cells are seen with edematous inflamed stroma. Pleomorphic endocervical lining with diminished mucin. So endocervical lining will show pleomorphism with diminished mucin. Obliterated ectocervical lining is noted. In lung, pneumonitis is noted along with pulmonary fibrosis and cytologic atypia. Radiation associated tumors. New tumor must be in the field of radiation. So the new tumor that develops due to radiation must be in the field of radiation. The organ in which it arises must have been previously documented as normal. So the organ showing new tumor associated with radiation, it must be previously free from the tumor. A symptom-free interval of 5 years should pass after radiation to label it as radiation-associated tumor. Most tumors that are radiation-associated, they are malignant. Few benign osseous and neurogenic tumors can arise. In skin, radiation-associated tumors, they are basal cell carcinomas, squamous cell carcinomas, and atypical fibroxanthoma. In head and neck region, we see sarcomas, carcinomas, sinonasal small cell neoplasms, mixed tumor of salivary gland, and thyroid carcinoma. In GIT, the tumors are carcinomas. In uterus, the radiation-associated tumor are carcinosarcoma and endometrial stromal sarcomas. Radiation-associated tumor of skin are osteosarcoma, fibrosarcoma, chondrosarcomas, and MFH. In soft tissues, the tumor that arise due to or after radiation are angiosarcomas, fibrosarcomas, lymphangiosarcomas, malignant fibrous histiocytoma, and malignant peripheral nerve sheath tumor. Pituitary sarcoma, neurofibroma, meningioma, and gliomas, they are tumors that are seen in central nervous system. Breast, the radiation associated tumor is carcinoma. In mesothelium, mesotheliomas are present. Thank you very much.